This is Dr. Ahmed Amin Nasser, and I have come this afternoon to share with you my ideas about green anesthesia. What is it? How could it be done? Is it a choice or obligation? I guess we are all obliged to make IV cannulation bloodless, or as we might call it, a green IV cannulation. All of it stem from my paper Green or Orange Anesthetic Practice, Choice or Obligation, which have been refused by a British Medical Journal in 2018 because it was beyond their scope of interest. Then published in 2019, few days before COVID spread. Expression green anesthesia, I claim that it was mine. Good morning anesthesia to patient, and then cannula time. Right? Blood spillage is common. Why? Nobody knows. A little touch on the tip of the cannula would easily prevent venous spillage. But where this devious tip is, nobody knows. Dangerous, of course, a time bomb for the unguarded operator. Detested with no shred of a doubt. Patient discontent. Surgeon, of course, cynically regards it as anesthetic blood loss. Finally, wet and dry cleaning, which is time consuming and waste would increase. It is eco-unfriendly. That's what we call a red cannulation. Now, I am going to reveal what green cannulation is. Our audit project uses gravity as a safeguard to produce bloodless cannulation without going on a hunt mission for the tip of cannula. Raise the site above the heart level to avail of gravity-induced venous flow reversal. Then stop raising. Flow stops. Needle out. Dry cannula. Blue bung in. No pressure applied. No spillage. Great. Great and green. Now, how does green cannulation look? Our ODP Emily had filmed that, so enjoy the greenery. Now the vein is there, and the cannula is in the vein, so we just release it, and we can see blood is coming out of the vein now, and I'm going to raise the hand above the level of the heart as gradually as the blood stops to come out. And here we go, we can see the blood here. You can see the blood still in the cannula. And I'm going to put the blue bung on that. And that's it. So there is blood here, some air, which is by default, it is there all the time. And it is bloodless with no pressure at all. Thank you. We had 40 adult cases. 39 cases proved my point and honored gravity-dependent green function. However, we encountered only one red case. Was it gravity failure? Disproving my point? We will see. A tall patient for total knee replacement, ACA3, hypertension, COPD, pulmonary hypertension, and mild cardiac insufficiency, sitting on a high trolley prepared by a tall ODP. Cannula in, arm is raised. By then, I found it necessary to ask that ODP to take needle out and attach blue bung. I started to scrub for subarachnoid block. Back to the scene, he tells me it was a red one.
I was crossed. What is that? 40th case? Last case is right. I didn't believe it. 39 cases proved my point. Only last case was red. However, it improved my point as I refined the technique to discover it is not just higher than heart level. It is how high you get the cannula above the heart, higher than the peripheral venous pressure. So, we raise the cannula side until flow starts to reverse, denoting vertical height higher than peripheral venous pressure. Then, and only then, stop, take the needle out, and connect. This is how successful green cannulation would finally look. Blood is still in cannula. Now we can say it. Good green morning anesthesia while doing green cannulation. It is not only just green, but it gives you a hint about JVP or even CVP, but in air. So you would develop a sense of heart efficiency. I always show it to my ODP. Outflow and inflow of blood proportional to the vertical distance from the heart. So besides being green, it is cardiac reserve protective, which could possibly help planning our anesthetics. By all means, this is not about being obsessively green all the time. More comfort to everyone, as it is about to become productively green. Visionaries propose that achieving environmental sustainability requires business to shift from exploiting the environment for profit to embracing mutual interdependence and radical eco-innovation. Well, by the same token, who needs a blue bunk? Wow. Then green cannulation is also effective, cost effective. It is due time now to come back to the neglected, time-honored, often thrown away white cap. Convincing? Going green is helpful? Let us sum it up. It is universally protective, waste reductive, reserve predictive, and finally, cost effective. Besides, it is a single-handed maneuver now. That won't necessarily open a new door for the next audit. Our next audit will be from green cannulation to cardiac reserve appreciation. By finding the correlation of ejection fraction and angle or vertical height of arm raising as evidence of being cardiac reserve predictive. I leave you now with good green afternoon. Thank you.